Hi everyone, I'm Dr. Z. I'm a clinical psychologist specializing in transgender care. Welcome to my channel. I want to make a video and talk to you about how lack of autonomy over your body and being able to make a decision over your medical and surgical needs actually may lead for some of you to further wondering whether you are truly transgender and further wonder whether you actually making the whole trans identity up. So let me clarify. I've noticed this actually in quite a few individuals I've been working with, and I thought that this can just happen to a number of people that I'm working with. This is most likely occurring on a larger scale. What do I talk about when I talk about body autonomy? I'm talking about your capacity to make decisions for yourself, especially in relationship to your body, in relationship to what the body needs. Body autonomy may include being able to consent to hormonal interventions in places, especially where informed consent is being practiced, a type of model of informed consent being practiced. But beyond that, we're going much deeper now into surgical too, where not only can you make a decision about hormones, but whether you should make a decision about a surgical intervention that you actually do need. And here's where I see the discrepancy. So a lot of you, majority of you, have gone to a medical doctor to get yourself on hormone regimen. That medical doctor has probably practiced informed consent model, which is great. And through talking with you and going over risk and benefits of the hormones and also assessing for the presence of gender dysphoria, they were able not only to diagnose you with gender dysphoria, but they were able to also assess whether you're able to understand risks and benefits of hormones and therefore the prescribed hormones for you. Well, this medical doctor has put diagnosis for you of gender dysphoria in a medical system, right? Otherwise, why are they doing any kind of medical intervention in the form of hormones? So clearly they're prescribing something. They're prescribing hormone regimen for you to deal with gender dysphoria. So therefore they had to put down diagnosis, and the only viable diagnosis in this particular scenario would be gender dysphoria. Great. Next step. You realize you're now getting ready, you actually need a surgery. Maybe you need to modify your chest, or maybe you need to modify your genitals, or maybe you need to modify other parts of your body in order to feel much more congruent. Maybe you're realizing those body parts are giving you dysphoria. So you go to this medical doctor, and by this time, you've been on hormones probably for some time, maybe 6 months, maybe a year, maybe 2 years, maybe 3 years, maybe 5 years. And therefore, you have affirmed for yourself that this feels affirming, this feels right, this feels in alignment with how I see myself. And therefore, you feel much more confident finally in your sense of identity. You may be questioning whether you truly are transgender, whether your mind is making this up, or maybe it's caused by trauma or any other kind of things. You most likely either not engaging in the thought process or questioning that very seldom. So you go to this medical doctor and you say, I'm now ready for surgical intervention. And what does the medical doctor do? They tell you, all right, sounds like a natural part of your transition. You need to go see a therapist, such as myself, and they need to write you a letter certifying that you have gender dysphoria and that you're able to make informed decisions, that you need the surgery. So here's where this part of the process can lead to some of you actually question if you are transgender and if you are making the right thing. Because after some time on hormones and feeling affirmed and feeling right and feeling congruent with who you are, you're then sent to my office or some other therapist's office. And you come into my office or again some other therapist's office, and now you're standing in front of a shrink. And you're sitting there and you know that, okay, so I have to validate that I'm transgender. I have to validate that I'm not crazy. I have to validate that I can consent to this. I have to validate that I need the surgery. And this feels odd. Why do I have to validate all these needs when a medical doctor already diagnosed me? Did the medical doctor make a mistake? Why am I sitting in front of a shrink that needs to now cross-validate diagnosis I not only been carrying, but for which I've been getting medical treatment for? Do you see the mind fuck? So this is a mind fuck that makes some of you, and I've seen this, question, am I really transgender? It's actually quite traumatic after being on hormones and or doing, not even being on hormones, or doing any other affirming steps and feel very affirmed, to now sit in front of another professional that deals with the psyche of mind and to go over whether you truly have gender dysphoria or not. And this process feels very disempowering. It robs you of any sense of knowing. It robs you of any sense of being able to know for yourself what's best for you. It robs you from trusting yourself first and foremost. And that's really quite traumatic. It's unfortunate and it's very painful. And I've seen this happen. I've seen it happen where I seldom see this happen with me. I'll tell you why. Because when people come to me and they've been on hormones, it's like, well, of course you don't need to validate. All I'm going to be seeing, let me just ask you, do you have a post-surgical support? Do you have somebody to take care of you? Do you have a place where you're going to be staying? I just ask those type of questions. Just ask whether you are able to take care of yourself. Because I know that a medical doctor already diagnosed you because you are on hormones. So the diagnosis is there. And by the sheer fact that you're talking to me and you now want to get surgery and ready for surgery is an indication that you have dysphoria, because otherwise, why would you go for surgery if you don't have dysphoria? But there's the therapists, unfortunately, who are less informed and less specialized, who will spend 6 months to a year with that person, 6 months to a year, talking in therapy about whether they have gender dysphoria, all the while this person is already on hormones. All the while this person is already maybe doing social transition. Maybe this person is already going by preferred name, preferred pronoun, their gender expression is in alignment. Do you see how that creates a mindfuck? Now you're sitting for 6 months to a year trying to validate and prove and to confirm that you really have gender dysphoria. And that type of counter process, in my opinion, is not only dangerous, it's counterproductive. So I wanted to make this video because I know that some of you have been through this process and it played a number on you. And I want you to know that you're not crazy, you're not making this up, and you need to trust yourself. It's not that you don't trust yourself, it's that messed up system, the archaic system that was put in place is mistrustful and doesn't make any sense. So it's really important that you trust yourself and that you listen to yourself and what your needs are. And hopefully you find a provider that doesn't have this gatekeeping mindset. And hopefully with the new WPASS, I'm really hoping they're going to move away from needing these letters, especially if you already had a medical doctor diagnose you, put you on hormones. You should be in a medical system as somebody that is struggling with gender dysphoria. And it should be a given that if you do decide to go through surgeries, it should be given that you already have it. And in the very least, you have also demonstrated a capacity to consent to hormones, and you have demonstrated ability to be on hormone regimen responsibly and without any issues. I think all of that should be just enough. So if you're watching this and you've been through the crazy rigorous process of proving after being with a medical doctor and being on hormones, proving yourself to then a provider, tell me, what did that feel really disempowering for you? Did that feel like a mindfuck? Obviously, it did feel like another hoop you had to jump through, and another hoop you had to pay a lot of money to jump through, and it shouldn't be like that. But for those of you who are watching this, and if you are in the process of getting letters for surgeries, and if you find yourself in an area where there's not very informed providers, and they are taking you through a rigorous process of long duration of confirming you do have gender dysphoria, remind yourself that you know, and the fact that you're on hormones and they feel affirming to you, that's a huge, huge sign that you are moving in the right direction. And so sadly, there are providers there, they're doing what they think is their job doing. And sadly, not all of us are going to be 100% informed. So comment below, share, tell me, how do you feel about just sense of body autonomy? And again, we're talking about adults here, we're not talking about children here. So how do you feel as an adult about your sense of body autonomy and your right to make decisions about your body? Comment below. I love reading your comments, and I'll see you guys next time. Bye.